Did you know that your kidney sends you a report every single day? And most people just flush it away without even reading it. I'm Dr. Frita. I'm a board certified kidney doctor. And today we're going to talk about what your urine color is desperately trying to tell you about your kidney function. As a nephrologist, I take care of kidney patients every day. So I can tell you firsthand what happens when the early warning signs of kidney disease are ignored. 37 million Americans have kidney disease, and most don't even know it. And listen to this. Your urine color is one of the earliest visible signs that your kidney function might be slipping. Every color on that urine color chart matters. So I want you to share this video and stick with me till the end. Today, we're having a conversation that most people never have. Not with their friends, not with their family. Shoot, probably not even with their own doctors. Today, we're talking about what your urine color is desperately trying to tell you about your kidney function. Keep watching. Would you like my undivided attention as we discuss your specific medical journey? If so, you are in luck because I offer a concierge telehealth service where you can get my direct input on your health concerns. Be sure to click the link below. Be sure to give this video a like and a subscribe as we get started because I'm about to give you some very valuable evidence-based medical information. What is normal urine color? Normal urine color is pale yellow or light gold. Think lemonade or a very light straw color. Completely clear, colorless urine is not normal, nor is a dark amber colored urine. I'm talking about a pale yellow. The yellow color comes from urochrome, also called urobilin, which is a pigment produced from the breakdown of hemoglobin. When your kidneys are healthy and filtering properly, this pigment shows up as a pale yellow color in your urine. The more hydrated you are, the lighter the urine. The less hydrated you are, the darker the urine. It is important for your goal not to be a totally super clear, colorless urine because that can be a sign of overhydration, which can actually be stressful to the kidneys. And overhydration can dilute very important electrolytes like your sodium. And certainly, you don't want your urine to be super dark amber because that could be a sign of dehydration. And we know dehydration in and of itself can lead to kidney failure, pre-renal azotemia. According to the National Kidney Foundation and the Mayo Clinic, in healthy kidneys that are filtering properly, the normal color is pale yellow. Now let's break down what the urine color chart means for your kidneys. The first color is pale yellow to clear. As we discussed, pale yellow is the normal color for kidneys that are filtering and functioning properly. Again, if the urine is totally clear, that could be a sign of overhydration, or it could be a sign of a disorder like diabetes insipidus. In diabetes insipidus, the kidneys are not able to concentrate the urine properly, and this is a huge warning sign that you actually have a disorder. So yes, if your urine is pale yellow, like this part of the color chart, that is a good sign. Dark yellow or amber urine. Now, this is one of the most common color changes that people brush off, but you should really pay attention because it could be signaling something going wrong. The most common cause of a dark yellow or amber urine is dehydration. Your kidneys aren't getting enough water. When the kidneys are not properly hydrated, they concentrate the water in your body, causing you to have a darker, more concentrated urine. This is an issue because if the kidneys are having to compensate by putting out a concentrated urine, that is an early sign of kidney stress, and you need to do something about it. It's typically an easy fix, just drink more water. But if after good hydration, you find that you are still having dark yellow or amber urine, this warrants a call to your doctor. Of note, there are certain medications and supplements that can cause your urine to have a color change. Vitamin B2, for example, also called riboflavin, can cause your urine to be a neon or bright yellow color. This is harmless and is of no concern. But yes, dark yellow or amber colored urine is usually a sign of dehydration. Orange urine. Orange urine can be a sign of severe dehydration. It can also be caused by certain medications like rifampin, which is a very strong antibiotic used to treat and prevent tuberculosis. Medications like phenazopyridine can also turn your urine orange, and this has the brand names Azo and Pyridium. It's a urine analgesic used to keep your urine from having a burning sensation. Orange urine can also be a sign of liver and bile duct dysfunction. If the liver is not processing bilirubin properly, it can spill over into the urine, causing an orange color. And this can cause the kidneys to overcompensate, causing stress to your kidneys over time. Orange urine can also be a sign of jaundice or hepatitis, which can also lead to kidney problems over time. If your urine is orange and it cannot be explained by simple dehydration, medications, or diet, then this warrants a call to your doctor immediately. Do not wait. Also, orange urine paired with fatigue, swelling, or pain is a red flag. Definitely consult your doctor if you have this going on. Be sure to watch my video on 7 toxic signs of kidney failure you can find in your feet after you finish watching this video. Pink or red urine. This color is one of the most alarming colors on the urine color chart, and that alarm is usually warranted. Pink or red urine can signify hematuria, which is blood in the urine. Blood in the urine can show up as being pink, red, or cola colored, and this usually signifies that something is going wrong in the kidneys or urinary tract. Some causes of pink or red urine include urinary tract infections or UTIs, kidney stones, glomerulonephritis, which is an inflammation of the kidney filtering units. Pink or red urine can also be caused by bladder cancer, kidney infections, prostate problems. Not all pink or red urine signifies blood in the urine. Certain foods like beets, blackberries, or rhubarb can turn your urine pink or red. This is called beturia. Also, some medications like rifampin can cause you to have pink or red urine as well. If you have pink or red urine that cannot be explained by diet or medications, then you must contact your doctor immediately. Please don't wait. According to the American Urological Association, all blood in the urine warrants a detailed evaluation. Brown or cola-colored urine. This is one of the most serious warning signs on this entire urine color chart and often signifies that there is a compromise in your kidney function. Brown or cola-colored urine could mean that you have rhabdomyolysis, which is something that occurs when there is a breakdown of muscles, releasing the muscle pigment myoglobin, which is toxic to the kidneys and can lead to kidney failure. I've actually had to dialyze previously healthy people just because they developed rhabdomyolysis. Brown urine can also signify severe liver disease and acute kidney injury. Hemoglobin particles that are broken down from red blood cells can also show up as brown urine. Now, there are certain foods like fava beans and aloe that can cause brown urine. Some medications can cause it as well, but you always want to rule out a medical cause first. Having brown or cola-colored urine is a medical emergency, so you should call 911 or contact your doctor immediately if you see this urine color. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. Green or blue urine. Now, this is very rare, but it happens. I'm serious. And I can tell you, green or blue urine is usually connected to a medication or diet. Medications like propofol, amitriptyline, which is an antidepressant, also indomethacin, which is a pain medication, and NSAID can all be tied to green or blue urine. Certain things you eat can cause your urine to be blue or green. Usually food dyes, okay, like blue food dyes can do it. Rare genetic conditions like familial hypercalcemia can cause you to have blue urine, blue diaper syndrome in infants. Also, certain infections of the urine, specifically with a bacterium, Pseudomonas aeruginosa. This can cause you to have a green urine. And I can tell you, prolonged urine infections can definitely negatively affect your kidney function. Anytime you have green or blue urine, this is something that's so rare that it should always warrant a call to your doctor. Cloudy or murky urine. Cloudy urine is definitely a warning sign that should never be ignored because it could be a signal of urinary tract infection or kidney stones, sexually transmitted infection or STI. It can also be a signifier that you're having something going wrong with your kidney function. When it comes to kidney function, cloudy urine could be a sign of proteinuria or protein leaking through damaged kidney structure. Proteinuria can also show up as very bubbly or foamy urine. Cloudy urine can also indicate white blood cells leaking through the kidneys. That's not normal either. Phosphate crystals in the urine can also cause some cloudy urine. Now, this is usually harmless, but it's certainly worth monitoring. Now, if your cloudy urine is accompanied by fever or pain when you urinate or a foul smell, then you definitely need to contact your doctor right away because this could be a sign of a urinary tract infection like a bladder infection or cystitis or even pyelonephritis, which could definitely progress into an overwhelming sepsis. It's serious. When to call your doctor? Call your doctor if you have orange, pink, or red urine that cannot be explained by diet or medications. If you have brown or color-colored urine, definitely call your doctor or 911. Call your doctor if you have cloudy urine, especially if it is paired with high fever or flank pain, and if you have cloudy urine that's not going away. If you have green or blue urine, that's always a cause for a conversation. And certainly in general, if you have a urine color change that's paired with swelling, pain, fever, fatigue. Your kidneys work so hard for you every day, so please make sure you give them the attention that they deserve. Your urine color is not random. It is your kidney's way of giving you a report, so please take the time to listen. It is very important for you to be your own advocate. So now that you have this information about urine color, if you have a urine color change that is worrisome, be direct. Call your doctor and ask for a urinalysis, a urine culture. Ask for a kidney panel like a BMP or basic metabolic panel, or even a CMP, complete metabolic panel. That will also give you your liver function tests. Now that you know how your urine color is desperately telling you about your kidney function, I want you to be sure to share this video with the people you care about. If you found this information to be helpful and informative, please be sure to give it a like and subscribe to my channel if you have not done so already. I appreciate your support, and I will continue to give you evidence-based medical information. As always, I want you to do your best to live your healthiest, happiest life. I'm Dr. Frita.